Syphilis is a serious infection. It is caused by a very small germ, a type of bacteria. The scientific name is Treponema pallidum. It is a sexually transmitted infection, an STI. It most often spreads through sexual contact. People of any age, people of any gender, people of any background can become infected. For many people, the initial signs are very mild and often missed entirely. That lets the infection hide in the body, silently causing problems over time. It can mimic many other health conditions and may be hard to identify without a specific test. Good news, syphilis is not a life sentence. We understand it well. We have powerful tools to fight it. With modern medicine, syphilis is completely curable. The key, find it early and treat it correctly. The primary way that syphilis spreads from one person to another is through direct contact with a syphilis sore. These sores are a key sign of early infection and are called chancres. They can appear on or around the penis, vagina, anus, rectum, lips, mouth. The infection is passed during vaginal sex, anal sex, oral sex, when one person's body touches a sore on an infected person. The bacteria, Treponema pallidum, enter the body through tiny cuts or breaks in the skin, through the moist lining of the mouth, through the moist lining of the genitals, through the moist lining of the rectum. This direct contact is the most common route of transmission. A tricky aspect is that these sores are often painless. Sometimes, they are hidden inside the body, like in the vagina or rectum, so a person may not know they have one. Because the sores are not painful and can be hard to see, someone can have syphilis and pass it to others without realizing it. The sores usually heal on their own within 3 to 6 weeks. However, even after the sore is gone, the infection remains in the body. The person stays contagious and can continue to spread syphilis to partners. Another very serious way syphilis can spread is from a pregnant person to their unborn baby. This is called congenital syphilis. Bacteria can cross the placenta and infect the fetus. This can have devastating consequences: miscarriage, stillbirth, or serious problems affecting bones, blood, brain, and other organs. That's why testing during pregnancy is a critical part of prenatal care. Syphilis progresses through distinct stages if it is not treated. Each stage has its own set of signs and symptoms. The first stage is called the primary stage. This stage typically begins 10 to 90 days after a person is first infected. The main sign is the appearance of one or more sores, known as chancres. A chancre is usually a small, firm, round, and painless sore. It appears at the spot where the bacteria entered the body. This could be on the genitals, anus, or in the mouth. Because it's painless, it can easily go unnoticed. The chancre will heal and disappear on its own in about 3 to 6 weeks, but the infection remains. If the infection is not treated during the primary stage, it will move on to the secondary stage. This stage is marked by a skin rash. The rash can show up on one or more areas of the body. A classic sign of secondary syphilis is a rash on the palms of the hands and the soles of the feet. This rash usually doesn't itch. Other symptoms can also appear during this stage. A person might feel tired, have a fever, a sore throat, headaches, muscle aches, swollen lymph nodes. These symptoms are similar to the flu, so they can be mistaken for other illnesses. Like the primary sore, these symptoms will also go away without treatment, but the person is still infected and highly contagious. After the symptoms of the secondary stage disappear, the infection enters the latent stage. The word latent means hidden. During this stage, there are no visible signs or symptoms of syphilis. A person might feel completely healthy. This hidden stage can last for a very long time, sometimes for many years. Even though there are no symptoms, the bacteria are still living inside the body. The person may not be as contagious to others during this time, but the infection is not gone. The final and most dangerous stage is the tertiary stage, also known as late syphilis. This stage can develop 10 to 30 years after the initial infection if it has been left untreated. During this stage, the infection can damage internal organs, brain, nerves, eyes, heart, blood vessels, liver, bones, joints. This damage can lead to severe health problems, including difficulty with muscle movements, paralysis, numbness, blindness, dementia. Tertiary syphilis can be fatal. The damage is often permanent, which is why finding and treating syphilis early is so important. Ignoring syphilis or leaving it untreated can lead to devastating health consequences. In its early stages, the infection might seem like a minor issue, with sores and rashes that disappear on their own. This can give a false sense of security, making someone believe the problem is solved. However, This is a dangerous misconception. The Treponema pallidum bacteria do not leave the body. Instead, they go into hiding, transitioning into the latent stage, where they can remain for years without causing any noticeable symptoms. During this time, the infection is like a ticking time bomb, slowly preparing to launch an attack on the body's most critical systems. When syphilis progresses to its final tertiary stage, the damage can be widespread and severe. The infection can attack the cardiovascular system, leading to problems with the heart and blood vessels. It can cause an aneurysm, a dangerous bulge in the wall of the aorta. If this aneurysm bursts, it can cause life-threatening internal bleeding. It can also damage the heart valves, leading to heart failure. These cardiovascular problems can develop many years after the initial infection, appearing as a sudden and serious health crisis. Perhaps the most frightening consequence of untreated syphilis is neurosyphilis, when the bacteria invade the central nervous system. It can happen at any stage, but it is a hallmark of the tertiary stage. It can cause severe headaches, difficulty coordinating muscle movements, paralysis, numbness, problems with balance, dementia with memory loss, confusion, personality changes, and a gradual decline in mental function. The damage is often irreversible. Syphilis can attack the eyes, ocular syphilis, causing vision changes, decreased vision, and even permanent blindness. It can also affect the ears, causing hearing loss or deafness. The damage from late-stage syphilis is not just internal. The infection can cause gummas, large destructive sores, on the skin, bones, or internal organs. These problems highlight the critical importance of not underestimating syphilis. It is formidable when ignored, capable of causing profound disability and death, all of which can be prevented with a simple course of antibiotics. Testing is the only definitive way to know if you have syphilis. Many people who are infected do not have any symptoms, or their symptoms are very mild and easily missed. They might have a painless sore hidden inside their body, or a faint rash they mistake for something else. Without a test, they could carry the infection for years, unknowingly putting their own health at risk, and potentially spreading it to others. This is why regular testing is so important for anyone who is sexually active, especially if they have new partners or multiple partners. It is a simple step that provides certainty and, peace of mind. Healthcare providers use a few different types of tests to diagnose syphilis. The most common method is a simple blood test. This test does not look for the bacteria itself. Instead, it looks for antibodies, proteins your immune system produces to fight a specific infection. If you have syphilis antibodies in your blood, it means you have been infected at some point. Sometimes, if a person has an active sore, a doctor can take a fluid sample directly from the sore and examine it under a special microscope to look for Treponema pallidum. If you notice any signs of syphilis, such as a sore or a rash, see a doctor or visit a clinic right away. You should also get tested if a sexual partner tells you that they have syphilis. Even if you have no symptoms, get tested regularly if you are at higher risk, including anyone with multiple sexual partners and men who have sex with men. Getting tested is straightforward and confidential. At your family doctor, a local health department, a family planning clinic, or a dedicated STI testing center, the results are usually available within a few days. Knowing your status is a powerful tool. A negative result can bring relief and reinforce safe practices. A positive result is not a reason to panic, it is the first step toward a cure. Early detection through testing allows for simple and effective treatment, preventing the infection from progressing to its more dangerous stages. The great news about syphilis is it is completely curable with the right medicine. The most effective treatment used for decades is an antibiotic called penicillin. For most cases of early-stage syphilis, primary, secondary, early latent, a single injection of a long-acting form of penicillin is enough to cure the infection. The medicine is injected into a large muscle, usually in the buttock. This single shot is powerful enough to kill all the Treponema pallidum bacteria in the body, stopping the infection in its tracks and preventing any further damage. For people who have had syphilis longer, latent tertiary stage, the treatment is more intensive. They will typically need a series of 3 penicillin injections, given 1 week apart. If a person is allergic to penicillin, doctors have other options, such as doxycycline or tetracycline, taken as pills over several weeks. However, penicillin is still the best and most reliable choice, especially for pregnant individuals. After treatment, follow-up care is essential. Doctors schedule blood tests at intervals, such as 6 and 12 months, to ensure the treatment works. After a successful cure, Antibody levels should go down over time. This confirms that the infection is gone. Avoid sexual activity until the doctor confirms sores have fully healed and treatment is complete. Notify sexual partners so they can get tested and treated, protecting their health and preventing reinfection. Health departments can help with this process anonymously if needed. The most reliable way to prevent the sexual transmission of syphilis is to avoid contact with an infected person. Many people do not know they are infected. Using barriers during sex is a key prevention strategy. Using a latex or polyurethane condom correctly every time, for vaginal sex, anal sex, or oral sex, can significantly reduce your risk of getting syphilis. Condoms create a physical barrier that prevents contact with a sore. Condoms are not 100% effective. Syphilis sores can appear in areas not covered by a condom, so transmission is still possible. Open communication and mutual monogamy are powerful prevention tools. Long-term, mutually monogamous relationships with tested, uninfected partners are very safe. Before a new sexual relationship, talk about sexual histories. You can get tested together. Honest conversation builds trust. It helps partners make informed decisions to protect their health. Limiting your number of sexual partners lowers overall risk. Regular testing is a cornerstone of prevention for you and the community. If you are sexually active, especially with multiple partners, get tested regularly for STIs, including syphilis. Regular screening catches infections early, often before symptoms appear. Early detection means you can get treated right away. Early treatment protects you from long-term complications and stops you from unknowingly passing the infection to others. Avoid excessive alcohol or recreational drugs. They can impair judgment. Being under the influence can lead to risky sexual behaviors, like having sex without a condom. Staying sober helps you make safer choices. Using condoms, having open conversations, getting tested regularly, making clear-headed decisions. You can build a strong defense against syphilis. Syphilis during pregnancy poses a very serious threat to the health of an unborn baby. When a pregnant person has syphilis, the infection can be passed to the fetus through the placenta. This is known as congenital syphilis. The consequences can be tragic. The infection can interfere with the baby's development, leading to a miscarriage or a stillbirth. Up to 40% of pregnancies with untreated syphilis can end this way. This makes screening and treatment during pregnancy an urgent public health priority. If a baby is born alive with congenital syphilis, they can face a lifetime of health challenges. Some babies show no signs at birth, but problems can appear weeks, months, or years later. These problems can be severe and wide-ranging. Enlarged liver and spleen, severe anemia, skin rashes, jaundice, bone abnormalities, developmental delays, and seizures. Long-term effects can be devastating. As the child grows, damage to teeth and bones can cause characteristic changes. It can affect the central nervous system, causing hearing loss or total deafness, and infect the eyes, causing interstitial keratitis that clouds the cornea and can lead to blindness. These are permanent disabilities that can profoundly impact a child's quality of life. All of this suffering is entirely preventable. The solution is simple and highly effective. Test and treat. Public health guidelines recommend that all pregnant individuals be tested for syphilis at their first prenatal care visit. People at high risk may be tested again later in the pregnancy. If the test is positive, the pregnant person can be treated immediately and safely with penicillin. This treatment is very effective at curing the infection in the parent and, in most cases, preventing transmission to the baby. Early prenatal care is the best shield a baby has against the dangers of congenital syphilis. Syphilis is a serious and complex infection, but the message is one of hope and empowerment. It is a disease we can control. We have the knowledge and medical tools to prevent it from spreading and to cure it when it occurs. Replace silence and fear with clear information and proactive steps. Using condoms, having open conversations with partners, limiting your number of partners. These are powerful ways to reduce your risk. These simple choices are your first line of defense. Regular testing is not a sign of promiscuity. It is a sign of responsibility. Testing is the only way to be certain of your status, and it allows for early detection. If a test is positive, remember, syphilis is curable. A simple course of antibiotics, usually penicillin, can eliminate the infection and prevent long-term damage. Seeking care promptly protects you, your partners, and the community. Screening every pregnant person for syphilis is a top public health intervention. A simple, low-cost measure that prevents tragedy. Act early, get tested, seek treatment. You are making a decision that benefits everyone. We can stop syphilis, protect yourself, get tested, get treated, fast. Your health and the health of those you care about is worth it.